Let's look at how we might go about patient selection for GLP agents, basically the who of GLP selection with an animated video. The physiologic effects of GLPs fit well for the needs of patients with type 2 diabetes. We've discussed that glucagon secretion is deranged in type 2 diabetes. The fasting elevations of glucagon lead to an elevated fasting glucose. Blunting that improves the fasting plasma glucose. The postprandial surge in glucagon worsens postprandial glucose. Blunting that improves postprandial glucose. We know that insulin secretion is insufficient in type 2 diabetes. We would like to enhance it. That can improve both fasting and ultimately does have a downstream effect on postprandial glucose, but dominantly on fasting glucose. And we know that modulation of gastric emptying, which slows the rate at which gastric contents enter the intestine, can definitely improve postprandial glucose. Weight management is an issue for over 90% of patients with type 2 diabetes. Sometimes is worsened by drugs like insulin that stimulate appetite and tend to lead to increased weight. That does not appear to be the case with the GLPs. In general, they are at least weight neutral and most of the time across the board lead to some consistent weight loss. And perhaps most important, I think we need to look at glucose lowering as to some degree a surrogate endpoint. What we were hoping for with glucose lowering was not so much the glucose as what the patient outcomes are. And now we can consistently say there are a variety of agents within the GLP class that lead to that holy grail of our desire to help diabetics' outcomes improve, improved cardiovascular outcomes. So we have agents that appear to have very positive effects on cardiovascular risk and vascular health that might be put under the large umbrella of cardiovascular protection. Who are some examples of patients who might benefit from GLPs? Well, basically anybody who's not able to achieve their glycemic targets on metformin, or for persons who metformin is contraindicated, they could be an initial treatment. Patients who are overweight or obese in particular welcome something that will help them to address that battle. And as we've stressed, persons who have existing cardiovascular risk or cardiovascular disease evident. Patients who have hypertension or dyslipidemia, perhaps the cardiovascular favorable effects of these drugs would look particularly attractive in this population. And anybody who requires intensification of their glucose management.